All right, so diving in today, you guys sent in a ton of great stuff about holistic health, particularly from like nursing education and how they approach it. And so today we're going to kind of take all of that and try to figure out how this web of self-concept, sexuality, and spirituality is like how those all really play together in our own lives.
Yeah, I mean, the material you sent was really interesting because, it really focuses on this idea of holism and that health isn't just, about your physical body, but it really does like incorporate all of you. It talks about culture, self-concept, sexuality and your experiences there, and then, of course, spirituality and how those things affect patient care.
Yeah. One thing that I noticed a lot in the materials you sent was the idea that how we think about all these things, our self-concept, our culture, our spirituality, and our sexuality, all that really influences how we view healthcare in general.
Yeah.
And then kind of on top of that, how we view like diagnosis and treatment, when we get sick or whatever. And that, that kind of makes sense to me. Like all of those pieces probably contribute to whether we accept something, whether we deny something, whether we question something. So it seems like a really relevant topic.
It is. And what they really try to do is they try to use the nursing process, so like that whole assessment, diagnosis, planning, implementing, and evaluating the nursing process that we've talked about before. They try to apply that framework to this idea of, taking a holistic view of a person's health.
Cool. So let's start talking about self-concept. What even is that?
Well, so self-concept it's basically how a person views themselves. So it's those thoughts that you're aware of, and maybe even some of those thoughts that are kind of lingering under the surface that you're not really aware of, but they're in there, and it changes over time.
It changes over time, so it's not a fixed thing, right?
Yeah.
It's something that we're always kind of reassessing.
Always developing.
Okay.
And they broke down like the components of self-concept too.
Yeah.
They talk about like identity, which is,
Right.
that central question of who am I?
Mm-hmm.
Then they talk about body image, how do I view myself physically? And they talk about how, the reactions of other people can affect that. And then also like role performance. How well do I think I'm doing at fulfilling the roles in my life?
Mm-hmm.
All the things that I'm expected to do. And then, of course, self-esteem. So, how much do I value myself? How much do I like myself? How much do I appreciate myself?
Yeah, those are some pretty big concepts to wrestle with.
They are.
And you mentioned other people. There are a lot of things that go into our self-concept.
Yeah.
And a lot of them are actually external.
They are.
Can you maybe elaborate on some of those things that affect our self-concept?
Yeah. Well, I mean, they talk about things like, your sense of competency. How competent do you feel in different situations? They also talk about perceived reactions of other people. Like, how do you think other people are viewing you? How do you think they're reacting to your body or to things that you're saying? And, on top of that, how you interpret like their thoughts and feelings towards you and not just their actions. We have a lot of internal monologue where we're trying to guess what people are thinking and feeling about us.
Oh, I do that all the time. Like, what are they really thinking about what I just said?
Right,
Yeah.
exactly. So that's part of it.
Oh, wow. Okay.
And then, your relationships, your personal and professional relationships have a huge impact. And, they also talk about academic and your job and how you identify, with your career.
Mm-hmm.
And, they also talk about like your personality. Some people have like very high expectations of themselves, and that's just, built into their personality.
Yeah, I mean, like, are you someone who kind of gives yourself grace, or are you super hard on yourself all the time?
Right. And so that plays into it. And then, like specific events that have happened to you, how you've perceived like impactful events that happen in your life, your socioeconomic status, like how much money you make and your perceived, status in society.
Mm-hmm.
That also influences how you view yourself and, like how you've done in the past and your ability to do new things, to master new experiences. All of that goes into this idea of self-concept.
Yeah.
And then, of course, there's your cultural identity. How does your culture view, all the different aspects of you, and how does that shape your self-concept? So it really is a combination of all of those things.
Wow. That's a lot.
It is.
So, okay, so that's a lot to go into about self-concept.
Yeah.
But you mentioned roles.
Yeah.
And there are a lot of different roles that we play, and those can cause stress too.
They can.
And I think most people who are listening are pretty familiar with this, but they talk about things like role conflict, which is just what it sounds like. Like you have multiple roles, and sometimes they're conflicting. You're getting pulled in different directions.
Well, like trying to be a parent and also trying to have a career, and balancing those two roles.
Exactly. And then
Yeah.
there's this thing called the sick role,
Yeah.
where, you behave a certain way when you're not well.
Right.
And that in itself can cause stress because
Right.
you're not fulfilling all of your normal roles.
Yeah.
And then there's also something called role ambiguity, which I think is really interesting.
Yeah. That's when, the expectations of a role are just not very clear. So you're not even sure what you're supposed to be doing.
Mm-hmm.
And then when you combine those two things, like role conflict and role ambiguity, you get this thing called role strain,
Okay.
which can be really, really difficult.
Wow. And then finally, we have role overload,
Mm-hmm.
which I think everybody listening has experienced this one. And that's just basically where you have way too many roles to juggle.
Right. You're just trying to do everything and you
Mhm.
don't have the time or the resources to do it all.
And it's not just the things that we're doing, like, all these roles that we have and all these things we're trying to do, but it's also, our families have a huge impact on our self-concept as well.
They do, yeah. Oh.
And it's kind of like, from the very beginning, the family unit is kind of like this container where you learn who you are and where you fit in and what's normal, what's acceptable, what's right, what's wrong. All those things come from your family.
Mm-hmm.
And I know from reading some of this material, they talk about how, parental support and monitoring, and the amount of support that you get as a young person can really affect your self-esteem and the amount of risk that you're willing to take.
Yeah, for sure. Like those positive early environments can really set the stage for healthy development.
Yeah, for sure. And when we're talking about healthcare, the material that we read, they really talk about how important the nurse's attitude is when they're dealing with a patient.
Oh, absolutely.
It really affects the patient's self-concept. Like, are they treated with dignity? Are they made to feel good about themselves, or are they made to feel like a burden?
Yeah, it's like the nurse is kind of holding up a mirror to a patient, and how the nurse acts can shape how the patient sees themselves.
Yeah, that's a great way to put it. And I noticed too that they really emphasize like being positive and matter of fact.
Right.
Building trust with the patient and really being sensitive to nonverbal cues, like even something like, your facial expression or your body language can really affect a patient who's feeling vulnerable.
It can, yeah. Just those little things can make a big difference.
For sure. So when it comes to actually assessing self-concept in a nursing environment, they go through all those different components, like the identity, the body image, the role performance, the self-esteem.
Mm-hmm.
And they try to figure out, like, what are the stressors on that patient?
Right.
And how do they normally cope? And what stage of life are they in? All those things come into play.
And who are the important people in their lives?
Yeah. And they also consider that. Like, who are their family? Who are their significant others? Like, how are those relationships impacting their self-concept?
Right. Yeah.
And then there are certain behaviors that they look out for to kind of assess if someone's self-concept has changed, in a negative direction.
Yeah. They mention things like avoiding eye contact.
Mm-hmm.
Maybe their posture is slumped. Maybe they're not taking care of themselves as well as they used to.
Mm-hmm.
Maybe their appearance is kind of unkempt.
Right. And they also talk about being, super apologetic all the time or overly critical of themselves. Maybe they're hesitant to talk or they start crying really easily.
Mm-hmm.
And they list like a bunch of other behaviors too, like, maybe they're really dependent on other people. Maybe they're, they don't really want to express their own opinion. Maybe they've lost interest in things that they used to really like. Maybe they're kind of, they're really passive and they have trouble making decisions. And in more severe cases, maybe they even start to, hurt themselves.
Right. And from a nursing standpoint, like those observations might lead to, specific diagnoses like disturbed body image or disturbed personal identity or impaired role performance or even situational low self-esteem. So they're looking for all these things to try to assess the situation.
Right. And then from there, they work together with the patient, and maybe with other healthcare professionals, and they try to come up with a plan to improve that patient's self-concept. And that can happen in a bunch of different places. It can happen, in the hospital, at home, in long-term care. So it's really about, figuring out what that patient needs and trying to tailor that plan to that particular person.
Yeah, for sure. And making sure that, they're treated with respect and that their dignity is maintained.
Okay. So that's self-concept. Let's move on and talk about sexuality.
Okay.
You know, these materials that you gave me, they define sexuality really broadly. Like it's all the different aspects of being a sexual being. And they really emphasize that it's super important for our well-being. You know, it's not just a physical thing. It's also an emotional and mental and social thing.
Right.
And they make a distinction between sexuality and then sexual health, which is, it's more like that state of well-being related to your sexuality. So it's like all the different pieces coming together to create a positive experience.
It's like, are you feeling good about your sexuality?
Yeah.
Are you experiencing it in a way that's healthy and fulfilling?
Exactly. And then there are a lot of different pieces that kind of make up our sexual identity.
Yeah.
Like gender identity. So that's that internal sense of being male or female or both or neither. And then sexual orientation. So who we are romantically and sexually attracted to.
Right.
Like heterosexual, lesbian, gay, bisexual, all the different ways that we can identify. And there are a lot of different things that can stress us out related to our sexuality.
Yeah.
And, the material talks about a lot of them, like, reproductive health issues, which are a big one for a lot of people, a lot of couples. And then, stressors related to, being LGBTQ plus inality. And then, just like sexual dysfunction in general.
Right.
And then also like changes in our physical appearance as we age and, hormonal changes that can happen throughout life. And then, of course, sexually transmitted infections. So it's a lot to be thinking about and a lot of things that can really cause a lot of stress.
That they can.
And then they also talk about, menopause, which is a huge one, and sexual abuse, which, I think we're all aware of how traumatic that could be and how long lasting the effects could be. And then also pregnancy, which has its own kind of, physical and emotional changes that go along with it.
Right, right. And how those can, influence your experience of sexuality.
Absolutely. So when it comes to promoting sexual health, they talk about some really important things like contraception. It's important to understand what the different methods are, how they work, how to use them correctly. And, that consistency piece is really important. Like whatever method you choose, you got to be consistent with it.
You do. And they talk about like the importance of, preventing STIs and the different ways that they can be transmitted, like, through sexual contact, obviously, but also oral genital and anal genital contact. And using barrier protection, like condoms, is super important to prevent STIs. And they also go into, specific STIs like HIV. They talk about, how that's transmitted. HPV, which is, the most common STI.
Right.
Chlamydia, which is, I think they said it was the most commonly reported infectious disease in the U.S. And syphilis, which, a lot of people don't really know about. But it has, different stages. And in the first stage, it can cause these sores. They're often painless, but they can spread the disease. And then in the second stage, it can spread through contact with those sores. So it's really important to be aware of the signs and symptoms of STIs.
Yeah. And a lot of these are things that, most people don't learn about.
Yeah.
In school or from their families or whatever. So it's really good information to kind of put out there.
It is.
And then there are some other alterations in sexual health that they talk about, like, infertility, which can be a huge, huge source of stress. Sexual abuse, which we talked about before. Personal conflicts, emotional conflicts that can impact your sexuality. And then sexual dysfunction.
Right. Like there's a lot of things that can go wrong.
Yeah.
And, they can be really difficult to deal with.
Right. So when it comes to assessing someone's sexual health, in a healthcare setting, it's really important to kind of see the world through their eyes, and put aside any personal judgments or beliefs that you might have. And it's really about trying to figure out what their expectations are and what their experiences have been.
And, there's all these factors that can influence someone's sexuality.
Right.
Like physical limitations, functional limitations, the state of their relationships, their lifestyle choices, their development, how old they are and their stage of life. And then going back to what we were talking about before, self-esteem and self-concept.
Right.
How do you view yourself? Does that impact your sexuality?
Absolutely. And they talk about taking a sexual health history, which is basically, just talking to the patient, asking them about their experiences, their concerns, their questions. And there's this really cool model called the Placid model. Have you heard of that?
Oh, yeah.
It's basically a framework for healthcare professionals to use when they're discussing sexual health with their patients. And it's really kind of a step-by-step approach. So the first step is permission, which is just giving the patient permission to talk about these things, because it can be a really sensitive topic.
Right.
And then the next step is limited information. So you're giving them some basic information about whatever they're asking about.
Yeah.
And then specific suggestion, so you're offering some more tailored advice. And then the final step is intensive therapy. So if the patient needs more help than you can provide, you're referring them to a specialist.
Right, which is really important because, as a nurse or as a healthcare provider in general, you're not necessarily trained in all the nuances of sexual health.
Exactly.
So knowing when to refer somebody is critical.
Absolutely. And then they also talk about how illnesses and injuries and even medications and just the aging process can all have an effect on sexual health.
Yeah.
And they emphasize, doing physical assessments, teaching patients how to do self-exams, and educating them about the signs and symptoms of STIs.
Right, right. And, just like with self-concept, they have, specific nursing diagnoses related to sexuality, like problematic sexual behavior, difficulty coping, specifically related to sexual health, lack of knowledge of contraception, impaired sexual functioning, and risk for impaired reproductive function. So they're really trying to take a comprehensive look at all of these different issues.
Yeah, for sure. And it's really about maintaining that person's dignity and their sense of self, and then creating a plan. An individualized plan that addresses their specific needs and has, clear, measurable goals. And they point out that, for a lot of patients, resuming sexual intimacy is a really important part of getting better. Mm-hmm. And that requires, teamwork and collaboration with other healthcare professionals. Mm-hmm. And it's not just limited to one specific setting. Like, it happens in health promotion, it happens in acute care, it happens in restorative and continuing care. So it's something that needs to be addressed across the board.
Right. And it's really about recognizing that, sexuality is part of who we are as human beings.
Absolutely. Okay, last but not least, let's talk about spiritual health.
Okay.
And I'll be honest, I had a little trouble wrapping my brain around how they were defining this, but I think I get it. Mm-hmm. So they kind of define spirituality as like it's almost like this force, like almost like a breath or a wind that kind of animates a person. Mm-hmm. And it encompasses that awareness of our inner selves, like who we are on the inside. Mm-hmm. And that it's also about that connection to something bigger than ourselves. Mm-hmm. And that could be, a higher power. It could be nature. It could be, just a sense of purpose in life. Mm-hmm. And they make a really clear distinction between spirituality and religion.
Yeah.
Religion being more about, like organized practices and beliefs. You go to church or you go to the temple or whatever.
Right, right.
And they also talk about how spirituality can really have a positive impact on how we cope with things.
Oh, yeah.
Like anxiety and stress and even depression. And it's almost like that, that inner strength that you can draw on when things get really tough. And there are certain things that can happen in life that kind of really bring spirituality to the forefront.
Yeah.
Like facing a serious illness or getting a terminal diagnosis or even having a near-death experience. Those things can really make you think about what it all means.
Mm-hmm. They really can. And when you're thinking about like how nurses approach spirituality, it's really about caring and providing support. Mm. And taking what's often called a faith history. So trying to understand, what does this person believe about life and health? Mm-hmm. And do they believe in a higher power? Mm-hmm. And, what's their overall worldview? Like, how do they see themselves fitting into the world?
Yeah, and they use a lot of different ways to assess that.
Yeah.
They might just listen to the patient and ask open-ended questions. They might use tools like the FICA tool, which, mm-hmm. Asks about faith and the importance of spirituality in their life, their community, and how their beliefs can help them with what they're going through. Mm-hmm. And there's also the spiritual well-being scale, which is a more formal assessment tool. Mm-hmm. Mm-hmm. So when it comes to spiritual assessment, they look at, faith and belief.
Yeah.
Like, what's their religious guidance, if any?
Yep.
Or, what's their personal philosophy of life? And then they look at life and self-responsibility. So, like, how does the patient understand the limitations that their illness has placed on them, and how are they going to adjust to that?
Right.
And then there are a bunch of nursing diagnoses related to spirituality, like risk for spiritual distress or defective spiritual distress, hopelessness, spiritual distress, decreased spiritual distress. So it's really, they're taking a really broad look at this aspect of a person's well-being.
Yeah.
And when it comes to planning, they use all of their knowledge about spiritual resources to develop a plan that, that really works for that individual patient.
Mm-hmm. And often, they'll collaborate with chaplains or other spiritual advisors to provide more comprehensive care.
Right. And then when it comes to putting those plans into action, it's not always about, doing specific things. Sometimes it's more about just, being present with the patient, answering their questions, encouraging them, expressing trust, really just being there for them emotionally.
Yeah.
And there are other things like, helping them find hope, helping them make sense of what they're going through, helping them connect with spiritual resources and communities. So it's really a very individual approach to spiritual care.
Right, it is. Because, everybody's spirituality is different. And how they express it and how they experience it is unique.
Absolutely. So as we wrap up this deep dive, it's really clear how connected all these things are. Like our self-concept, our sexuality, our spirituality, they all kind of feed into each other.
They do, yeah.
And they're not just these separate little boxes. They're all part of who we are. So, I think a good question for everyone listening is, how do you think your own sense of self, your experiences with sexuality, and your spiritual beliefs shape how you understand your own well-being? Or maybe, how have those things helped you get through tough times?
It's something to kind of think about.
It is.
And if this conversation has made you curious to learn more, there are a ton of resources out there. Keep exploring, keep asking questions.
Absolutely.
It's all about, getting to know ourselves and others on a deeper level.
Right.
Thanks for joining us for this deep dive. We'll see you next time.
Yeah, see you next time.